Well, hey, everybody. Thanks for joining us here. We are just before the top of the hour. We're going to give folks, you can see some people are just coming in now. We're going to give folks some time to get in. While we do that, I just want to thank everybody for joining us. I think none of us, of course, wanted to see a death come from ransomware. Or as a result of ransomware, but sadly, this is a foreseeable event, something that people have been saying for a long time could happen. And so when it did happen, we wanted to put together this panel to talk about it. So we'll give people another 30 seconds here to come in. Excuse me, and we'll get started and talk through it. So what we're going to do today is talk through what happened, why it happened, what healthcare organizations should be doing as a response to it, and some things that we're seeing as we work in healthcare day in and day out, both doing HIPAA risk assessments, doing penetration tests, monitoring their environments, and investigating threats 24/7. Hopefully we can prevent something like this from happening again. Of course, nothing's 100% preventable, but we want to work with we want to make sure that we're all doing our damnedest to prevent it. So it looks like we have a bunch of people in here now, and I think we can go ahead and get started, and people will join as we go. So we are CI Security. We are a company in Seattle and Bremerton, Washington, and we do professional services, as mentioned, and manage detection response. We monitor healthcare environments 24/7, 365, investigate and respond to threats. This case that we're going to talk about today, the ransomware that led to a patient death. So what happened here is that criminals attacked a university in Germany. They exploited Citrix vulnerability to get in and hit 30 servers. The university that they attacked was attached to a hospital in Dusseldorf, and the hospital system shut down. Patients were then diverted, including a woman with life-threatening injuries. Unfortunately, she died on her way to the hospital because the hospital she was diverted to was 20 miles away. And then just in this morning, the ransomware was Doppelpaymer, and a loader may have been in the system at the university for months. The folks who we're going to talk to today are Drex DeFord, longtime healthcare CIO, Mike Hamilton, former CISO at the City of Seattle, and now CISO for CI Security and founder, and Fred Langston, very long-time healthcare InfoSec consultant who helped write the HIPAA security rule. My name is Jake Milstein. I've been a journalist for 25 years and now work at CI Security. We are recording this, but since it's a webinar, the only people who will hear are the people talking. So let's start, Mike, with you. With that news this morning about the type of ransomware, what does that tell you?
So, they're saying it has Russian fingerprints on it, and I think there is fairly high confidence through examination of this particular strain of malware, Doppelpaymer, and it's been attributed to Russian actors. Now, there's always this question as to whether or not they are, independent actors. Are they criminals that have the tacit backing of the state, or are they actually supported and directed by the state? And to me, this is always a question, because of things that have been happening. We see North Koreans false flagging as organized crime to steal money. right? So that's a tactic, right? We can hide behind organized crime. So this is a hospital. It's a hospital in Dusseldorf. And right now, the Russians and the Germans are really sniping at each other about the fact that, Vladimir Putin goes around poisoning people, allegedly. And, Germany's called him out for that. Right now, there's a pipeline under construction between Russia and Germany that could be threatened by all of this. And, it's always a question in my mind, who is the actual actor behind this? What is that actor's motivation? Because the ability to knock down infrastructure at the local scale like that has the impact of loss of life, everybody's been expecting this. And I don't know, if this particular loss of life could have been prevented. Hey, did I have COVID? No, they had heart disease. So they died of heart disease or pneumonia or whatever, right? So it's really hard to say that was the cause. But the fact that a hospital got knocked down, all right, knocking down that kind of infrastructure, that's my concern, that these gloves are actually coming off.
The criminals actually said that or they seem to have intended to only target the university. There was a note left in one of the servers that named either people or I forget what it is, or named the university. Mm-hmm. And so the police, when they told the criminals, "Hey, you've hit a hospital," the criminals apparently gave them the encryption key. Does that change? Does that still indicate that it was a nation state?
Not necessarily either way, right? I mean, I'm sure that the intent was not to kill somebody, or have a death attributed to this. And there has been, this kind of vocal, okay, we won't attack hospitals, but that hasn't been followed up with actual action. Hospitals are going down like crazy. So, was it? I'm still gonna, work on this false flag theory myself.
Yeah. And just a a note to the folks attending. There's a chat. On the right, we can see whatever you put in the chat. If you have questions, you can put in questions. You can put in the chat. We'll watch over there. Drex DeFord, hospital CIO. Drex, you've been in the seat of many of the folks on the call here. You see something like this. You're in charge of InfoSec, of the systems in a hospital. What goes through your mind?
So I mean, let me start with just listening to Mike speak. Really reinforces, if you're in cybersecurity, how much you really have to have your head wrapped around international business stuff that's going on, political intrigue that crosses state lines, nation lines, national lines. It's pretty interesting. It's one of the reasons I always like to hear Mike talk, because it's not just technical stuff. There's a lot of other stuff that's wrapped around this, or could be wrapped around this. As a CIO, I've always looked at, these things where, whether it's cybersecurity breach or something that happens that takes the network down, or it's something that you did, updating a piece of software that went wrong and the network went down. Anytime a network goes down, it is a bad thing for patients and families and providers. And so we have to be really aware of that and be very thoughtful about, how do we do business continuity planning? What are the exact specific steps that we take? How long can we have an outage before we start to have the conversations around, do we divert patients to other facilities or transfer patients from our facilities to others? And what's all the impact and challenge associated with that when it comes to treating either patients that we have in-house or patients who may be inbound to us? There's a lot of process and steps that go through this business continuity stuff, especially when you make the decision to divert. There's a lot of your partners and a lot of the public who are still going to bring patients to your facility. So you have to think through all that and have a plan for it. Have a well-documented plan. Have something that you've exercised and you really know how it's going to work, because it's in this kind of emergency that is exactly the time you don't want to just play it off the cuff, right? Figure it out in advance, plan it in advance, and then, execute your plan.
And Drex, those plans, they've probably changed since March, since the pandemic really hit. So, talk to me about that. You know, folks who are in the hot seat now.
Sure. I mean, if you think about all of the individuals that you sent home, work from anywhere, work from home, a lot of those people were critical components of the plan that you had. So if you haven't pulled that plan out to review it, now would be a good time. I think the important parts of all of this is to share this information about this incident with your organization so that they see and understand that this is a real thing that happens. It has happened now. And then make sure that you have those plans in place and that you've exercised them and that you understand that the other part of this to me is that we still are really good at building really high walls around our hospitals to try to keep the bad guys out. But what we see over and over again is that the bad guys seem to always find a way to get in. And so the important part of this becomes catching them right when they walk in the door and kicking them out, as opposed to just being overly reliant on having a big, strong door, right? So think about your monitoring. How are you keeping track of what's happening in your network? Do you see these odd little changes that might happen that could be an indicator that you've been breached? If you don't have that kind of a capability, that's a thing you need to focus on too. And
Fred Langston has worked in healthcare environments for a very, very long time. Fred's helped countless organizations improve their security posture. Fred, you see this news. What goes through your mind?
A whole bunch of things go through my mind. One is it doesn't really matter, frankly, if it's a nation state. It's bad guys who have poor intelligence about what they're actually attacking. I mean, they think they know, and anybody can be collateral damage, right? And I think that's just the commoditized nature that everybody needs to be aware of. Anybody's a target. It doesn't really matter, I don't think anymore, whether you're a nation state or not. I think the other component to this is people really need to run through tabletop exercises to understand what exactly does this like when I'm facing something this catastrophic. We do DR exercises, but if you're not focusing on something like ransomware, I've lost everything. What does this mean? You should have muscle memory built up. If you're not ready to start transferring patients and understanding what those triggers are, this is an outcome that, we'll find out. Maybe they've done everything right. We don't know. But this might be an outcome that could have been avoided if they had acted differently. We don't know. I don't think they want that to be an outcome, or any of us want that to be the outcome, that we could have done something differently. So without testing, you'll never know what those problems are.
So Fred, I got a question for you. You brought up, and I forget the number that you gave the other day, but it's actually not likely that this is the first death that has been attributed to a disruption event at a hospital, right, for the purpose of extortion or just disruption. And you had some number, and I can't forget what it is, but it had something to do with the number of extra minutes that it took to get to a patient because of the need to fall back to manual processes, right? It was something like 2 extra minutes for a heart patient. Do you remember what that was?
Yeah, that was one of them. And there's even a further study that they've been collecting statistics and saying, from a predictive standpoint, we know that people have died from this. There's just no question. We can't point to the exact ones.
Yeah.
There's enough data to point to the chain of events that led to this poor outcome. But we know they've happened, right? And this is the one time we can go, here's our textbook example now. Here's our case study. Here's how shall we point this out? This is a real thing, right?
Yeah. Yeah. The hyperbole around this one is useful to raise awareness, that's for sure.
Yeah.
Yeah.
And
we rely on electronic systems now more than we ever have before. And one of the studies that Fred pointed out in a sidebar conversation with us earlier this week was one that said that after a cybersecurity incident, it takes longer to get patients, for example, to the cath lab. And there's a lot of things to be inferred in that, not the least of which is that we have post cybersecurity incident upped our own cybersecurity stuff. So like putting in more passwords and more roadblocks, doing things to build the wall higher, right? which actually impacts patients and families. And that's exactly the effect that we don't want to have. So it's an unintended consequence of some of the reactions that we have when we get breached.
Yeah, and in the chat here, Michael Nixon says healthcare will continue to be attacked for two reasons. They have cybersecurity insurance and they pay ransoms.
I'll add a third reason to that. And it's the same reason that local government is in the crosshairs too, is because they do something so critical, they cannot stand any operational outage at all. And they don't invest in security like corporations do, that, have to, meet a bar for shareholder expectations and third-party security and things like this. They're just kind of getting into this now. So they're poorly protected, they're underserved, and they're hypercritical. And yes, their insurance companies will pay. Insurance companies' business model is part of what got us here. I got to say that.
We talked to an insurance company yesterday, though. And Jake and I did, and we kind of dove into this a little bit. The other thing that's happening is that while health systems and other, especially young businesses, rely on cybersecurity to sort of be there, hey, if something happens to us, we've got insurance. The insurance companies now are continuing to mature this model too. And they're saying, if you don't have these things in place, we're not going to even give you insurance. And certainly we've seen them recently say things like, we don't insure stupid. If you've done something really dumb, or if you lied to us on the application, your insurance is null and void. So that is another progression of things that's happening for healthcare systems.
I'd point out too that a lot of people aren't realizing how fast the IP, the device, and things that can be affected in ransomware, how fast they are, expanding within organizations. I talked to a critical access hospital yesterday, 25 beds, and they have 1,500 devices on their network.
That's
right?
what they know of, right?
Right, and if you have to recover with 1,500 devices out, that's a small team of a couple of people. You're out for a long time, right? This is catastrophic impact.
Well, and what lends itself to that, catastrophe is, these attacks that get out of control, right? And they've been known to do this. And so if, shutting down the servers that, handle your, EMR, et cetera, that's one thing. Insulin pumps, heart monitors, that's something else. And something goes really nuts and hasn't been well constructed. Really, it can be, the loss of life can be a lot higher than one person who died in transit to another hospital.
Yeah, the ransomware is like a bomb, right? You set it off, you think you know what you're blowing up, but in fact, there's tons of collateral damage.
Mm-hmm.
And that's exactly, what you're talking about, that whether it's medical devices or, as you said, from a nation state attack, the general mayhem that can be caused in a community because a hospital is down is really significant and may not be what they intended to do, but that's what they did.
I'll tell you what, if the Germans catch these actors, there's going to be hell to pay.
Yeah.
Well, and I hope they do.
And so in terms of catching them, they've already talked about criminal charges, but they've also talked about an investigation of the hospital. Drex, you mentioned, if you don't do everything your insurance company says, but it actually, boy, it kind of sounds like Germany is thinking of going after the hospital here too.
Yeah. Well, when it comes to criminal or civil prosecutions, I'm not a lawyer, and I don't mean to badmouth lawyers, but sort of putting on a lawyer-like hat, you have to start to think, are we ever really going to catch these bad guys? And maybe not, but we know where it happened, at the hospital. And so there's a whole set of questions that unfold for that hospital then around, did they invest in cybersecurity? Have they underinvested in cybersecurity? Is there a disgruntled employee who would like to talk about how network infrastructure hasn't been upgraded? And so maybe that's an opportunity for a switch to be exploited, or how long and challenging the change control process is at this hospital to get a patch put in place. You only need a few of those, and in a civil lawsuit, you wind up having some exposure. And so health systems have to think about that too. Yes, the bad guys who set off the bomb are the bad guys, but they're going to look at this holistically and see what else might be to blame because of some of the unintended consequences. And the hospital winds up getting dragged into that, often because they're one of the organizations that has a deep pocket and an insurance company.
I'd like to point out too that the person that may have the crosshairs pointed at them at the hospital may not have anything to do with the cybersecurity organization.
Yeah.
It could be somebody that was involved in the patient transfer process that was not, robust enough, and that's where it broke down. That's somebody that's never thought about cybersecurity affecting their life ever, likely, and now they may be in the crosshairs from a cybersecurity incident.
Yeah, and I think they are going to investigate at the hospital, because that's just, law enforcement's got to look around and see what happened. And, how this initially started, was this intentional by an insider? We don't know. I mean, that could be in scope. So I think, of course, they have to investigate and look at this. I don't think, the hospital is going to get penalized over and above what would ordinarily happen for whatever the regulatory environment is in Dusseldorf in Germany, that would have penalized them in the first place. I don't think this is an extra thing they're going to add on there, but they are going to go through their investigation for sure.
I would imagine too that the patients or the patient family will wind up, if this was in the US, I'm not sure what the rules are there, but the patient's family will sue the hospital and try to drag all this stuff out. There'll be some kind of a settlement. So over and above the reputation damage, the impact, to the organization's outage time, they're going to, and whatever regulatory fines they're going to have to pay, they're also probably going to have to pay this, settle or come up with some other kind of plan to settle this lawsuit. And Fred's point, I want to say one other thing too. Fred's point actually was, he's hit a home run here, and that is that the people who may have nothing to do with cybersecurity may be the people that ultimately wind up bearing some of the blame for this, and the inactions that may have occurred that could have allowed this to happen. However, that winds up getting construed. And that could be the CISO, of course, but the CIO or the CEO or the board of directors or board of trustees for that organization. All those people may have been involved in some decision that a lawyer will construe as something that contributed to this. So the exposure can be pretty great.
And Michael points out, last report I read, 90% of healthcare HIPAA breaches came from email. Drex, you just worked on a report.
I know. I wish I had it handy, but you can download this report.
I can paraphrase.
Yeah, you can download this report from our website. And actually what we've done is we've taken the data from the Health and Human Services breach portal, the wall of shame, and we have consolidated that into a report that looks at the last 18 months and compares each 6-month period, where the breaches came from, what kind of organizations they came from, and what were some of the routes. And certainly email was up there. It was a significant contributor.
And one of the things that you said about the report, breaches down, one of the ideas was that the dwell time may be up, that the attackers may be laying in wait. That appears to be what happened here. The attackers were in the university system for who knows how long, and then last Thursday, boom.
Yeah, I'd like to hear Mike talk about that, but from the report that we did, the number of reported breaches were way down in the first half of this year, which led us to sort of think that maybe what was happening was that health systems had been breached, but didn't know it yet. The bad guys were in and they were laying the traps and they were sniffing around looking for the crown jewels, but they hadn't sprung them yet. And that, like you said, is kind of what happened here. Mike?
Yeah, and so I love that report. I really enjoyed, diving into that with you after you had finished that. And one thing that stood out to me is one of the reasons I think that records breaches are down. Right? You can monetize health records to a certain extent, and they are worth more on the dark market. And by the way, a whole bunch of dark market just got shut down. 179 people got arrested, and apparently the French police can surveil all kinds of encrypted communications and have been, and they busted the Tor network. So heads up on that. Wow. But I think one of the reasons is that in order to monetize health records, it's really done in more of a onesie twosie way, right? Individual cases of fraud. It's not done at scale. You can certainly use that information for other things at scale, right? So like all of the unemployment insurance fraud that went on, health records would lend themselves, right, to doing that. But I think part of the reason for the drop in records breaches is the fact that extortion is a much easier way to monetize access to somebody's network. And I do think you were right. I do think that once the pandemic wanes, outposts will have been created all over the place and lots of triggers are going to get pulled. I completely believe that. But I do believe that the drop in records has to do with a change in the business model of criminals.
So I can verify that from our IR practice, which has been busier than it's ever been for the last 6 months, and most of it's ransomware, that almost every instance we see, they've been in at least 10 days. They were exfiltrating data. Nobody goes in and just executes a ransomware payload anymore. I got to exfiltrate your data first, slow and slow. Once I have your data, then I'm going to execute the ransomware payload. If you don't pay, I come in with the secondary extortion of, your data's for sale. We do dark web scraping, and the amount of companies for data for sale is going up almost exponentially as we do our rate. We scrape almost every couple days to see what's the delta, how many people are added or subtracted. It's going up right now. So that's the method of the day that everybody wants to use. So they're going to spend some time. They're going to add other backdoors. We're finding, that most people eradicate the initial, or not the initial, but the one of the components of the attack. But they've usually left all sorts of other tools and backdoors and other accounts across the network.
In the chat, we've put a link to Drex's healthcare data breach report. If you want to download it, it's at that link there. Joseph asked a question, Fred and Drex. So what do you guys think will be the breaking point in healthcare since hackers know the organizations will pay the ransom?
Well, it's the insurance companies that'll make that decision, right? That's who's paying this, right? The healthcare companies are saying, yes, we have to because of our nature of our business. Lives are at stake. But ultimately, the people pulling out the checkbook is the insurance company, right? Mm-hmm. So the only people that are going to be able to say, we're going to stop this, or not stop it, but we're going to change our approach to it, with the insurance companies when they say, you know what, it's too expensive to keep paying. Right?
Yeah. I'm going to strongly agree here in a slightly different way. This is not my idea, and I'm sad that I'm not the guy that thought of this first. But it is likely that regulatory requirements become right? They're all over the place right now. I mean, especially if you're a bank, you're getting examined 29 times a year. I believe that insurance companies are going to be the ones to set all the requirements for the controls that you need to have in place, certifications that you need to hold, et cetera, et cetera, et cetera, because they're the ones that hold the financial liability here ultimately. And I think insurance companies are eventually going to, be the regulatory, bodies here that say, we won't insure you unless you're this cyber tall.
I think there's when you think about healthcare today, if you're going to participate in a government payer program known as Medicare, which for most health systems, that's at least 50% of how they get paid. If you're going to participate in Medicare, you have to have a certification. And one of those organizations is a Joint Commission. The Joint Commission goes in and surveys hospitals and ultimately tells the government that these people are doing everything right, and except for maybe these few things, and I'm sure they're going to work on those. If the government accepts that, you can get payment. I think that's going to continue to transition into cybersecurity. You're going to get to the point to where if you're going to do business with the government, like you said, Mike, you have to be at least this tall. If you're going to do business in the state of California, you have to be at least this tall. This is the other thing that's happening. A
Have to be twice as tall.
You do. A lot of this proliferation of cybersecurity rules and regulations that are coming out of states because the federal government isn't staying far enough ahead on this. And so if you're an IDN that's doing business in 4 or 5 states, it can be super crazy to try to figure out how to stay compliant. But I mean, I think that's certainly part of it. Between the insurance companies and state regulators who can be really aggressive about this, one way or another, they're gonna paint people into a corner.
Yeah, and especially with right. So privacy is driving a lot of requirements right now, right? I would say privacy is driving security, and with California's CCPA and what's coming up is the California California Privacy Rights Act, which is done through the initiative process and not the legislative process. And so it can't be pulled back. They can't change that. This is going to get tough. And, California led the way with, what was it, Fred, SB 1386 in 1998, which became the first breach reporting law. New York has got the SHIELD Act now. And not only the SHIELD Act, which is a privacy statute, right, but in their Department of Financial Services, they are fining the living crap out of people right now. And what's going to happen is if the federal government continues to abdicate its responsibility here, which is a pretty good bet, we're going to end up with 50 of these. And when you have 50 privacy statutes from 50 states that you have to comply with, if there is a glitch, you're in a world of hurt.
And it's interesting. We were just on another panel recently where we were talking about privacy, but I want to get back to a question here. Michael says, "Hey, what do you think when a business associate says they've had a ransomware attack, but don't worry, EPHI was not compromised?" Mike, you've talked a lot. Yeah, go.
I'll
Mike.
take that. So right now, number one, there's this double extortion method that's being used, right? In general, when you have some kind of event, a ransomware attack, right? They've been in there for a while, right? They have found exactly what they need to disrupt to make your business stop and to get you to pay attention to that, ransom request. And part of that is exfiltrating data. And I think we all heard about Blackbaud, right? Where Blackbaud was a service provider for a number of organizations, many of them in the health sector, a lot of them nonprofits. And what happened was they paid the ransom and they negotiated with the crooks and said, okay, you have to promise to destroy any data you stole, okay? Which is wonderfully naive. And so as a result, every one of the customers of Blackbaud has had to do a public falling on their sword and say, we probably lost these records. We don't know, but we have to assume that we did. And so if somebody, Michael, came to me and said, business associate said, well, we were breached, but everything's cool. No, everything is not cool. And I want to tell you something that's going on right now. This is up to the minute. There's a company called Tyler Technologies. Tyler Technologies is a service provider for lots and lots and lots of local governments. And they run a system called Munis, which is an ERP system for tons of cities. Tyler Technologies webpage is down right now. They're in the middle of a ransomware attack. And it is highly likely that the credentials for every Munis system that they manage have been lifted. So if you know anyone in local government, tell them to lock the Tyler Technologies people out of their Munis systems right now.
It's this Blackbaud thing. You're exactly right. It's a huge deal because it is a system that is essentially sort of the CRM for all of the foundations, all of the part of a healthcare systems organization that deals with people who are making donations to their health system, and not just healthcare, but like Mike said, a lot of other charities too. So talk about absolutely the wrong people that you want to lose their information and their records, right? Many health systems are not for profits and only survive because of donations that the local community makes to their organization to keep them running. If you do something, if you have to reveal that, this situation has occurred and you might have lost their information, I got to think that at least some of the people who make donations are going to think about making donations to something else instead of the local hospital. And that's not good for any of us.
No, and by the way, we were just part of an article, Drex, you and Mike were part of an article about cyber poverty. The places that can't afford, giant, to build their own SOC, to do, to spend millions of dollars on security. And that plays right into that, right? I mean, these are the ones who are also raising money and living on the money that they raise in their communities.
Yeah, there's definitely when you look at this sort of continuum of healthcare organizations, there are haves and have-nots. There's definitely a gap between different kinds of healthcare organizations. And that can be, this Blackbaud thing really, because it feels like I see a new listing in the HHS wall of shame every day where somebody else has had to step forward and say, because of Blackbaud, we have to report. And that's another thing you have to really remember about third parties, about BAAs, is that when they do something wrong, you're the one that has to report. So you really need to make sure you have all of that work with your BAAs really tight, including making sure that they're doing the things they should do.
Yeah. It's worth pointing out, too, that unauthorized destruction, which that ransomware attack, if it involved DPHI, that's a reportable, no question.
Mm-hmm.
I mean, unauthorized destruction is bad including it, right?
Yeah. Yeah. And a lot of those, a lot of the information that can be in the Blackbaud system, in those charity kind of systems, these are patients that we had, and here maybe some information about the kinds of things we did for them when they were in the hospital. And that's where you get sunk, right? That information is there. And if it's taken, it's EPHI and you're off to the races.
Yeah, Drex, you made a really good point, and I forget what we were chatting about, and I think this was yesterday, but every day is Groundhog Day, so I apologize. You were talking about the way that the health sector hospitals are monetized, and the fact that this series of events is forcing more of them into consolidation, acquisition, and changing to a risk-based, and I forget what your terminology is because you're the expert guy. Can you drill on that a little bit? Because I think that has relevance here.
Sure. This was, I'll try to do it very briefly. Most hospitals for years and years and years have been what we call fee for service. I do a lab test, I bill the insurance company or the person for that lab test. I do a surgery, the surgeon bills, and everybody. I do one, you pay me for one. We're moving to a system now that's much more at risk. And it's in different stages in different parts of the country and different markets. But that is essentially where I make a deal with you that when I do a hip replacement on a patient, you pay me just X amount of dollars for that. And it's up to me to make sure that somehow in all of that, I make money. And we do that by making sure we have really tight processes and that the patient gets out of the hospital really quickly, and we have good follow-up and they're not readmitted and all of that. So what we saw during the pandemic is that organizations that had moved to taking risk or value-based care, those organizations financially did better than those who are doing fee for service, because obviously we had states mandate that they stop taking patients to reserve capacity for COVID. So if you were fee for service, all of your production lines stopped. And if you were value-based care, you continue to get paid for patients who may not now be showing up, which is good. Now, maybe there's a backlog and all this will sort itself out. But if you're smart enough as a bad guy to know who's who, that's another way for, that I worry that the bad guys will figure out these are people who actually might be able to pay a ransom versus those who, we might just actually completely shut down that hospital or medical practice, which we see happen regularly now too.
And I actually think the other side of that is a consolidation could eventually be good, because the larger organizations understand a little better, because they got some margin to work with, the value of controls, and the smaller orgs are sitting ducks. And I think as they get bigger and pulled into larger organizations that have existing security policy, process, etc., it will improve them. So there could be an upside there from the fallout from COVID-19 and ransomware flattening hospitals and people starting to die.
So, getting back to the Germany, since, back to people dying, a question came in here in Germany. Will the authorities require to see the full network traffic packet as part of their investigation? Fred, you've been in these investigations. What do you think?
I'm guessing they don't have full network packet capture. That's pretty rare unless you're, using something like our service. That's kind of a key, but it's a rarity to find that. I don't, unless it's one of our customers, frankly, I don't expect to see it at a hospital. And most of the time you're left flying blind. To be honest, the forensic capabilities and the logs that are kept are usually meeting a minimum standard for regulatory requirements, but they're not necessarily built out for detailed forensic analysis. But when everything's burnt to the ground and you've got ransomware, there's not much forensic work that's going to happen, because if you think you're going to come back and fix all the things that the bad guys took advantage of the first time, you're making a much bigger pile of work for yourself than building from scratch, pulling data out of backup and rebuilding. Right now, that's neither option is good. They're both disastrous, but one of them's less cumbersome and frankly less prone to having it happen again than the other.
Just real quick, Chris Bevel made a good point here. He was talking about an FBI investigation and how 6 million records got poached. The takeaway from that comment right there is that it's known that 70% of organizations, when they have been subjected to records loss, are notified by a third party. Third party doesn't really need to tell you when your network is crushed by ransomware. So that 70% trend, that may be trending down.
So we're about 41 minutes into this here. I want to get back to one of the things we said we would help people with, which is, okay, you've seen this happen, and Mike, for those of you who know, he sends out a daily blast every morning, and it's headlines in InfoSec. And I'll put a link to it in the chat if folks want to sign up. But there's a deluge every day of news, of breaches, of new attacks, of things police are doing, of things criminals are doing. There's so much. You're in the seat of being the CIO or the CISO. You see all of this. It's not like you can go running to the board or running to the CEO every day and say, "Look at this, look at this." You can't. You'll end up being the boy who cried wolf. And so, but this one's different. This is the first, there might have been other cases, but this is the first confirmed, directly linked death. So I'd like to hear from each one of you, what do you do with this? You're in that seat, how do you treat this differently? And what kind of things are you trying to get done in the organization now? And how do you get that done? Drex, start with you.
Well, I think always when any of these kind of things happen, you'll have board members and other executives turn to you as the CIO or the CISO and say, how are we not ever going to let this happen to us? And the how we're not ever going to let this happen to us can't be a drip by drip attack or preparation to create a security program. It has to be a holistic approach that you are working on regularly and identifying gaps and helping everyone understand the risk that's associated with that and what it takes to kind of close those gaps, all in the context of nothing is perfect. And the bad guys are always moving fast, and they might come up with something that we haven't thought of yet. But the more of that waterfront that you can cover, the more you can put a good security program into place. And that really does include monitoring. I mean, you just can't do it without monitoring now. The better off you are going to be able to answer these questions when they come up. And they're going to come up. They come up every week, every day. Sometimes you're getting an email from a board member or a fellow exec, somebody else saying, how do we never let this happen to us? I don't ever want this to be my hospital. And you got to be able to answer that.
Fred?
So it's kind of in line with what Drex said, because this points out three things that are common in all people that suffer this. They have a lack of visibility. They don't have the ability, when they do see something, to respond fast enough to stop it before it turns from data exfiltration into ransomware, or even moving laterally for ransomware. And then there's the training component, because over 90% of the time, somebody clicked on an email or clicked on, here's your OneDrive file, enter your password, right? That's how this happened. You can almost belay money on that. So there's the training component. Those three things are common to all this. All of them need to be shored up.
And Mike, I'm going to ask you the question before I ask it. Folks, we're going to wrap up pretty soon. So if you have questions, put them in the questions or in the chat so we can get your questions for you. And Mike, what do you think?
Okay, so here's what I think. First of all, I'm just going to pile on with both these guys. Yeah, you got to monitor the crap out of your network and figure out, when something is weird is going on and be able to take a look at it. Setting that aside, the most dominant technique right now for getting access to a network is, people are biting on email, stuff like that. But when they're biting on email, they're not launching malware generally from email. It's leading to a place where they give up their credentials. It's credentials that are under attack more than anything else right now, because if I have your password, I just walk into the network and I'll just plant my little bomb wherever I want it. Okay. So credentials are under attack. So yes, you can spend gobs of money and you can train your people over and over and over and over not to bite. And there will never be a firewall for stupid. People are going to bite. You will never get past a 5 to 8% recidivism rate. Not necessarily recidivism, but it only takes one person. So what good does it do to spend all that money to train people over and over and over and over when 4 or 5% of them are still going to be inquisitive enough to get fooled? Okay. The better idea, I think, is to make it impossible. And this is a standard that was demonstrated to the world by the country of Singapore. Right after the WannaCry attack, their entire health system was crushed by ransomware. And it was the North Koreans that did it, looking like organized crime so they could steal money. And the thing got out of control and spread globally. Okay. Soon as that was over, country of Singapore said, no more of this crap. You work in a hospital, you get no internet access, full stop. So, number one, pervasive use of multi-factor authentication makes the whole credential thing a whole lot less relevant. And number two, a policy of personal use on a personal device, and you're not going to be Facebooking on the computer that we give you for work anymore, runs a whole bunch of the problem completely into the ocean. So why not do those things? Why not burn the capital to set a policy and say, nope, no more Facebook at work, forget it. Everybody's holding a personal device. This is where Facebook lives. This is where Gmail lives. And a whole bunch of the problem is just gone. So yeah, monitor your network, but get with the program here about, making it impossible for this to happen. I'm getting pissed.
You talk a lot about this too, Mike, where most of the time when we wind up with a ransomware problem that we see, it's a general dispersion of ransomware. It's not somebody really trying to get to a hospital. It just happens to be that somebody's using Gmail at home and they got a mail that they clicked on and we're off to the races.
Yep.
But I also think, and this is probably heresy for me to mention this, but that adding MFA tends to be the number one new control that adds to that lag in delivering care. And while you and I don't,
it's true.
That way, we've been doing, you and I have been doing it since '95 using multi-factor authentication. It's second nature, but it's still there, right? And for people that need timely access to information to provide care, it may make a difference, right?
Mm-hmm. Well, that's true. And, additional security controls being placed into, healthcare environments are starting to get blamed for, reduced care, effectiveness, efficiency, right? Mm-hmm. Delayed care, right? Yeah, we're starting to see that.
Yeah. So it's a conundrum, no doubt.
It is. And, we're seeing in the chat here, people talking about, they get pissed too. Nobody, come on.
We're having our asses handed to us, man. This is, okay. Federal government, right, the Trump administration, did something I really like, right? I have been an advocate for creating a national policy that says, hey, you don't maintain a standard of behavior and you're looking the other way and all your people are criminals and they're robbing us blind, boop, all your legitimate business gets cut off at the border and your business leaders can go stand on your government's desk and figure this out. Okay, that's using a market force to get what you want. All right, and the whole, now I'm not going to call threatening TikTok an analog to that, but the federal government in okaying the Department of Defense's new policy of defend forward, they're going to go get these guys, and this is what has to happen. Somebody's got to get burned alive so that everybody else sees what happens when you F with us.
Well.
But how do you really feel?
Yeah, right. How do you really feel? Tell us more, Mike. Hey, I mean, this is, we got a note here from Michael. Thank you all. Best webinar all year. Appreciate you saying that. We wish we weren't having this one. We're all pissed. This is not why we like to have webinars. We like to prevent the attacks, not talk about them after they happen. Since this was thrown together, since we put this together pretty quickly, I didn't create a real special. Ooh, is that blinking?
It is blinking.
It is.
Ooh, why is that blinking? That's bad.
Nobody's epileptic.
Oh my gosh, let's try that again. I was trying to create a quick slide if you want to get in touch with us. There's the email addresses of the folks here. Happy to talk more and happy to make sure that this doesn't happen again. So email us, be in touch. Thank you so much for joining us today. Stay safe out there. Seriously, everybody. And
Really.
Be angry like Mike.
Okay.
You like
All right.
I've heard that.
Bye, everybody. Thanks for coming.
Bye, everybody. Thank you.